Foot drop is one of the most common symptoms of cerebral palsy, affecting around 1 in 4 patients. It is caused by the patient's difficulty in activating their dorsiflexor muscles, resulting in constant walking on the balls of their feet as opposed to the normal heel-to-toe gait. This can be due to muscle weakness or paralysis.
Ankle foot orthoses, or AFOs, are often recommended. They are external devices designed to control ankle and foot movement. Often made from plastic, carbon fiber, or fabric, they wrap around the lower leg to provide support and stability. Most AFOs are passive and work by immobilizing the ankle at a neutral position to improve balance. However, these often cause discomfort due to limited flexibility and lack of dynamic gait support. Therefore, we developed a dynamic AFO that adjusts ankle torque based on the individual's walking pattern, facilitating dorsiflexion and plantarflexion. This design enhances mobility and independence for the patient.
The different gait states are identified using 2 sensors, one at the toe and the other at the heel, to trigger a motor response that adjusts the ankle position to corresponding angles. For example, when the heel first strikes the ground, the foot will soon need to transition to a neutral 90-degree position relative to the leg. As the heel lifts off the ground during push-off, the foot will plantarflex and reach an angle greater than 90 degrees. To avoid rigid movement, we applied moving average filters that assist more dynamic motor assistance and allows the motor to adjust its rotation velocity, which can be controlled in the front panel. To customize the device's range of motion for each patient, we added a dial potentiometer that adjusts the angle at which the motor rotates relative to the 90-degree neutral position, which allows for controlled damping. The device is set up such that every time when the foot lifts off the ground, it counts as a step. As such, we can measure the number of steps taken by the patient every minute. The device is also programmed to record the percentage of time spent on each of the 4 states. Therefore, we aim to provide a record for health professionals to examine the walking ability and gait pattern of the patient, especially for assessing the effects of physical rehabilitation or medications. The transition between states occurs when the 4 sensor values exceed or drop below a certain threshold. Yet, this threshold may vary over time and across different patients. Therefore, we set up a calibration state where we measure the threshold values before proceeding to device operation. The device is powered by a servo motor that connects the leg part to the shoe part to allow control of the angle between the 2 components. This is designed to amplify torque by driving a large gear with a small gear, thereby increasing the torque applied to the insole.